I'm Dr. Kelly Glazer. I'm a family physician. I worked for ATSU SOMA for the past 5 years. I've been in medical education for about 10 years. And I'm here to talk to you today for the Still Healthy presentation about immunizations and really preventative practices. We're going to talk about the benefits, but also some of the downsides, not only of immunizations, but also show you some of the things that you have to think about as far as pitfalls from any sort of preventive practice, like some of the screening tests that we all think of too when we go to our physicians. So our objectives for today are to define preventive care and the periodic health exam. We're going to list what we call the levels of prevention and also give examples of 4 main types of prevention services. We're going to discuss a little bit the history of immunizations and how some of that history really led to some of the concerns that we hear about nowadays, some of the anti-vaccination movement that's going on. And we're also going to talk about the benefits and risks of vaccines. And we're going to talk about the processes that are in place by the CDC and other agencies to ensure that our vaccine supply is safe and effective. I have a little video on that. I'm actually curious about your guys' feedback on that. I didn't make the video, but I'm wondering what you think about the video, if you think it would be effective for the public, and it was designed for the public. And then we're going to finally just share a little bit of information. I'll show you some vaccine schedules. There's also an app, if you want to look it up, called CDC Vaccines. And you can look in there too and put your age in and look at your own specific health risk factors to help see what vaccines you might be, need to be getting. Okay. And then there's a lot of information also about adverse effects and all that, all the things that are on the vaccine information sheets. There's links to a lot of information in that app. And then we'll talk a little bit also about some future directions. So the periodic health exam is a special doctor visit that you go to specifically talk about preventive care services. A lot of times patients will show up with their doctor and they might be a little confused and they say, I'm here for a physical, but then they want the doctor to investigate all these medical issues that they've had. But preventive visit is really about discussing lifestyle interventions and things that we can do to make sure that we're living healthy lives. And typically we do this annually, but I don't think there's any clear evidence yet about what the actual frequency of that needs to be. And certainly for children, it happens much more frequently, especially in the younger, first 5 years of life. So preventive care, again, is an activity someone engages in to help them identify risk factors so that they can help minimize those risk factors causing disease or sequelae of diseases. So these are the 3 levels of prevention. So there's primary, secondary, and tertiary prevention is targeted at different stages of disease development. So primary prevention is targeted at when someone doesn't have a disease. We're trying to prevent them from ever getting a disease. So that's where vaccinations and immunizations fall under, is under primary prevention. We want to give you protection before you get exposed and potentially contracted, right? Secondary prevention is targeted at when people have disease but they don't know it yet because they don't have symptoms. And that's where all those screening tests fall in. So like mammograms and pap smears, and when the doc wants to check your cholesterol, or colonoscopies or other methods of colon cancer screening, all those fall under secondary prevention. You might have one of those diseases, but we don't know unless we kind of go looking for it. So those are the screening tests. And then finally, tertiary disease comes after someone's already been diagnosed with a disease, but we want to minimize their risk for having further consequences of that disease, either getting worse or even resulting in death. So when someone has a heart attack, we sometimes give medications that are cardioprotective so that they don't go on to die and have another heart attack or have heart failure. So that would be an example of tertiary prevention. And so again, these are the 4 types of prevention. And we just mentioned several of those: immunization, screenings, and that cardioprotective medicines would fall under chemo prevention here. But behavioral and lifestyle counseling is another mode of prevention that your physician often does, or your care provider often does with you in the visit, so that you can learn, okay, what do I need to do? How much should I be exercising? What should I be eating? Those kind of things. And so those are the types of prevention. And who makes preventive guidelines is really important to pay attention to. One of the organizations that I most frequently reference is the United States Preventive Services Task Force, because they look at all the research evidence that's out there and try and come up with recommendations. And they also rate their recommendations on the strength of the evidence that is already existing. And sometimes their rating might be insufficient. There's not enough evidence for us to really say whether this service is beneficial or not to our patients. Welcome, come on in. And then sometimes there's a lot of evidence. And then sometimes the evidence shows that actually what we were doing isn't so helpful. It's actually harmful. So sometimes we stop doing preventive recommendations based on the evidence that later on, after collecting data, we realize that doesn't actually help. So sometimes when you've heard probably recently about mammograms and some of those recommendations changing, that's coming from evidence that's been collected to show that, gee, maybe doing mammograms really frequently in younger women could have harms that we didn't really think about initially. So other organizations like the World Health Organization, the American Cancer Society is really big on making recommendations, especially when it comes to cancer screening. Specialty societies sometimes will make different recommendations. And like when it comes to mammograms, the USPSTF, American Cancer Society, and the American College of Obstetrics and Gynecology, they might not always agree. So that's one of the challenging things for providers and patients to really sort out with you during your wellness visits. And they'll usually ask you, well, how do you feel about this? Trying to get a gauge of, do you want to be more aggressive or less aggressive with some of your care? And then certainly insurance companies get involved in it too, because they're deciding what they're going to pay for or not, you know. All right, so how do we prioritize that? Well, one, because we can't just screen everybody for every disease known to man, right? That's just not cost effective. So they're going to focus primarily on the services that have the largest burden of suffering. That's the first thing. And then they'll look at ones that might have proven effectiveness. And if they're not very effective, then we might not recommend those things very much. Like we don't just do chest x-rays on everybody looking for lung cancer, because that's not a very effective way to look for lung cancer. Okay. And we want to choose ones that are high quality and safe too. Okay. So again, there might be risk to some of the things that we do. So like those chest x-rays, now we'd be exposing everybody to radiation if we did that, right? And then the cost of service and subsequent treatment needs to be reasonable and could be applied to the entire population. Could everybody afford, most likely, to get the testing that we're asking them to get free for it? And could they afford the treatment? That's even a little bit harder to say. That would be true. But that's a fourth question that does come into play a little bit. So if you think about immunizations with all of those, you know, that's kind of the mode that they were thinking through as they developed immunizations for patients. So just to give some definitions when it comes to immunizations. So an immunization is the actual process of administering something to somebody to help them develop immunity, which is our body's reaction to that substance. And the substance is a vaccine, which is pieces or the whole bacteria or virus that we've administered. And your body reacts to that and develops protection via development of antibodies. So that's how we differentiate those terms. This term, community immunity, actually, it used to be often called herd immunity. And we kind of stopped using that term as much because people don't like to really be thought of as just a person in the herd or a member of the herd. So we call it community immunity. And it comes from when you vaccinate enough members of the community, then the ones who are not vaccinated are still somewhat protected because the disease isn't able to spread as easily from person to person because there's a lot of people protected. And the reason that's important is because there are some people who can't get vaccines. So if they have a medical problem that vaccine could cause a risk for them specifically, then we want to make sure that there's enough people protected so that that person is still protected through community immunity. So any questions so far? Okay. So in the history, so there has been a lot of talk in the news for a long time, really 20 years, but there's been kind of a movement going on, they call it the anti-vaccination movement, where there's been a decrease in immunization rates here in the United States. And there's a lot of things that have happened historically that probably play a role in that, and that play a role in people's beliefs and their concerns about vaccines and their safety or maybe their purpose. Vaccination's been going on really for 200 years. So when I started researching this and started looking at the history, like I didn't know all the dates up here. I'm like, wow, 200 years, that's really a long time actually. But it started with smallpox back in the late 1700s. And the concept developed because there were some nurses, or nursemaids they call them, that work with cows that would get cowpox. And they realized that when they got infected with cowpox, they didn't get smallpox that everyone else was getting. Hi, welcome to my school. And so that's how they thought there must be something that's allowing them to be protected. And so that's when they first started doing a little bit of experimentation which is an early form of vaccination. They would take the pus from cowpox and literally spread it on them, and then they would get cowpox, and then later they would get smallpox. So really rudimentary form of vaccination. And then we developed some other vaccines in the 100 years later, but then we realized that the processes for how that was done, the safety and the quality probably wasn't really good. And so in the US in 1902, the Biologics Control Act was passed, and that was to help address the poor laboratory hygienic practices that were going on at that time. In the early 1900s and late 1800s, medicine was really unique. It was kind of all over there, and there were a lot of things like the bloodletting and all that you hear about that we would think would be really barbaric now, but I'm sure they thought made sense at the time for their theories of disease. But as we learned more, that's where some of these acts then came into play. There was also a lawsuit in 1905 called Jacobson versus Massachusetts. And what was happening with the smallpox at the time is people again thought, well, the people who are getting this disease and are spreading it are the poor in the communities, right? And so they were doing forcible vaccination to the poor and ethnic minorities too. So that was something that really rubbed people the wrong way. It was a huge controversy about the benefit of public health versus individual choice, And so that history has probably a role in why there are some people who are a little concerned or have reservations about the medical society and about vaccinations specifically because of actions like that had happened. So in 1910, the Flexner Report came out that really helped kind of focus medical schools on, like, we're going to look at the biological basis of disease and really think about doing practices that we think are safe and effective and not harmful. So that was one of the big turnarounds, and there were a lot of medical schools that shut down after that. There were medical schools all over the place before then, and a lot of medical schools shut down after that report came out. And then over the next 70 years or so, we had multiple other vaccinations developed. And then type of vaccines kind of then grew from like being just a whole organism to being component organisms, or like one component that some organisms produce are toxins. So vaccines developed in certain toxins. And so that kind of grew. And then in 1986, that's when we started still, again, bringing up some concerns about, are these really safe? What some people might be getting sick. And so they developed the National Childhood Vaccine Injury Act, which created basically a reporting system for adverse events for vaccinations. Okay. And then the other thing that really has spurred the current anti-vax movement is that in 1998, there was an article published by a physician researcher about a possible link for measles, mumps, rubella vaccine to autism. And so I think most of you probably heard about that. But about 12 years after that, they found out that he falsified his research. And so they had retracted that article. I think he served prison time. I don't remember the details of that. It was a big deal. So, but that certainly didn't help people's fears when it came to vaccines, right? I mean, no one wants their kids getting autism from vaccines, right? So, so that is a big concern. So we're going to go back to the concerns and risks later. I'm not done with that conversation, but I'm going to just briefly here mention, well, what are the benefits of immunization? So one, it can help prevent disease. It creates what we call artificial immunity. So rather than natural immunity, which is if you have chickenpox and I get chickenpox from you, and then I'm immune to getting chickenpox again, that was naturally acquired immunity from getting the disease spread person to person. But artificial acquired immunity is from the vaccine. You know, someone didn't have the disease, I didn't get the disease, but my body developed an immune response to the vaccine, and I still don't get chickenpox. So the benefits of that are I'm less likely to be sick or out of school, out of work, all those kind of things are benefits to society for doing it the artificial way. It's also less expensive to prevent disease than treat it, right? So if we have vaccines for pneumonia and we're not sick, you know, we don't end up missing work, but we also don't end up in the hospital, which can be quite costly, right? And then also the benefits of developing that community immunity through artificial means. So here's just a slide to show a little bit of the improvements that have been made since vaccines have been developed. The number of cases you have of several of these diseases and how much they've decreased over time. So it's quite substantial, actually. And so here's a slide. I have two slides here about community immunity. So this one is about the pneumococcal vaccine, and this is how we know community immunity works. Is we developed the pneumococcal vaccine to protect kids from getting pneumonia, ear infections, all the things that the pneumococcal bacteria can cause. And what we started noticing is that adults who used to get pneumonia, the hospitalization rates for pneumonia were going down. So they were starting to be protected via herd immunity from just the children being vaccinated. So that was a good benefit of that. Another more recent example is with the human papillomavirus vaccine. So there's a study that was just published a couple months ago this summer in the Lancet. And they really looked at multiple studies, actually, from about 60 million people who've been in these studies for HPV vaccines and 8 years of follow-up afterward. And they're seeing substantial improvements in decrease in rates of what we call pre-cervical cancer, cervical dysplasia, which is what then turns into cervical cancer several years down the road. So that's why we all get pap smears as women, so that we're detecting that pre-cervical cancer before it ever becomes full-blown cervical cancer. So, and the interesting thing is Australia's been really aggressive with their HPV vaccination, and they actually think they're going to eliminate cervical cancer by 2030. So that would be pretty amazing. For males, a lot of males actually get anogenital warts, and it can also cause throat cancer too from HPV. So there are several things that will probably be benefited from having that vaccine. And the other exciting thing about this particular vaccine is it's the first cancer that we're preventing from a vaccine. Now, it is a cancer that's caused by infection, so it's not a non-infectious cancer, but that's a pretty cool thing. All right, so what worries us, though, a little bit is that the immunization rates are dropping. I tried to find more recent data than this, and I was really struggling to find something that was pretty comprehensive. So in 2016, if we look at individuals and adults, again, I tried to mostly focus on adults except for the top one, which is children. So children are generally supposed to get a certain series of vaccines all the way up through age 4. And when we looked at those kids, only 70% actually completed all the shots that they were supposed to get. Okay? So there's a lot of missing there. And then same thing with adults who are older than 65, you know, pneumonia is kind of a risk for them, and influenza is a big risk for them. And so we really try and be really proactive in trying to immunize older adults for influenza, but we're still only hitting like 70%. And when we start looking at adults over than age 18, look how low that drops, 43%. That's pretty amazing that only half of adults in the U.S. or less than half are even immunized against influenza. So we don't have great herd immunity going on. But there are other issues, obviously, with influenza, because that virus changes every year and changes so rapidly. That's why we have to do a new vaccine every year. It's not lifelong protection for that year. And then also another vaccine that most adults should be up to date on is the tetanus, diphtheria, pertussis vaccine. And on that one, we're even worse. Only about 26% of adults are actually up to date on that vaccine. So that's pretty shocking. For the tetanus, diphtheria, pertussis, after age 19, you're supposed to get the tetanus, diphtheria, pertussis vaccine. And once you've had that once as an adult over age 19, then you just get what tetanus, area combination vaccine every 10 years. Yeah, oh, but if you get like a dirty wound and it's been more than 5 years, they give it to you earlier than that. Yeah. So, but typically just think, has it been 10 years since I've had my vaccine? Maybe I should talk to my doctor about that. So I'm not going to give any specific vaccine advice in this talk today because that really is a personal conversation you should be having with your own care providers who know you, your medical health issues, because all of that really does come into play into your decision making about getting vaccines. Here's another slide to show a little bit about the effectiveness of vaccines and how that might be changing with the loss of herd immunity that we're experiencing. So here was how many measles cases we had from 1950, and in 1960s is when the MMR vaccine was introduced. So you can see how that dropped really dramatically after the introduction of that vaccine. But now we're down here in the 2000 to 2020 range, and that's what we're seeing. We're starting to see a lot more outbreaks of measles development. And so in 2019, just this past June, there were 1,044 cases of measles. So that's something that, I think we have to be a little concerned about. I don't think we're probably ever going to end up back to like this many cases. Although interestingly, if you think about it, this is kind of easy. I'd have to look what the population of the world was back then. On my other side, it was much earlier than that. Obviously, the world population was much smaller then.
It's 7 billion now, and we get half of 7 billion.
Yeah, maybe that. Yeah.
Half a billion has been added.
Half a billion has been added.
Half a billion, yeah, 600 million.
Yeah. It's a lot of people. So here's a little map, though. What this is showing us is the states. There are 18 states that allow non-medical exemptions for vaccines. So there are medical exemptions that you might get, whether you had a specific reaction that was concerning to a prior vaccine. Used to allow exemptions for like egg allergies and stuff like that for like flu vaccine, but even now that is less of an issue actually. But there are 18 states that allow non-medical exemptions. The ones who have the most higher number of people actually taking non-medical exemptions are the darker colors here. So you can see Arizona, that there's a lot of non-medical exemptions happening in Arizona. And when we just look at county level, the number one county for non-medical exemptions in the entire U.S. is Maricopa. So, and it's 3 times the number of non-medical exemptions as the second highest county. So we're at about just under 3,000 non-medical exemptions for vaccines. And the second highest was like 900 and something. So, so we have a lot of that going on here, and that certainly potentially puts us a little bit more at risk living here, knowing that our herd immunity in this community might be lower than ideal. I suspect a lot of those might be religious in nature, but I don't know for sure. That's my guess.
When you look at
just because you're also looking at Salt Lake. Yeah.
So when you're looking at the map, one is probably the largest component.
Yeah, when you're in yeah, that could also be a factor. I don't have any data specifically about per capita. That would be non-medical exemptions per capita. So what are some of the myths, though, about immunization that might be leading to some of those non-medical exemptions? Again, I don't have a specific link for that, but these are some of the things that we hear as physicians. Is that, well, if I'm just good at washing my hands and I don't talk into those spaces or I stay away from people who are sick, then I'm not going to get sick either. That I get sick when I have this vaccine. We hear that a lot. Even the last time my husband had his flu shot and his tetanus diphtheria pertussis vaccine, he had fever and a little bit of chills that night. And he didn't look good. But he recovered by the next day, and that's part of the process of us developing immunity when we react to that. That's what our bodies do. It thinks it's an infection, so it's trying to fight it. And that's what our body does. It's raise our temperature to try and kill the organism that's making us sick. So while it can be uncomfortable, it's usually not a big deal. We call it a side effect, okay? An expected side effect. But most people don't like feeling that way. And if they're not warned that that could happen, they get quite concerned. There are some serious side effects that can still happen. I have another slide about the actual side effects that we'll go into, but that there is, generally considered a myth. That natural immunity is better than acquired immunity is a myth. Vaccines that can cause autism and other serious problems. Well, we know that autism has been disproven. There are a couple serious problems that we know vaccines can cause, but as a general rule, they're generally pretty safe. Otherwise, they wouldn't be out there. Giving more than one vaccine at a time increases risks of harmful effects. That has not been proven to be the case. So a lot of parents were concerned about, getting 4 vaccines at once for their children and, wanted to space them out. But the end result of that means often ends up being that they don't end up getting all their vaccines, or they don't get them in a timely way so that they're really protected. And then since vaccine preventable diseases have been eliminated from my country, I don't need to get vaccinated. So like polio is one of the ones that we hear about there. Well, there's no polio here, so I don't need that vaccine. And so here are some actual pitfalls. So with the immunizations, we definitely have side effects. And that fever, I never knew it could be that intense. I witnessed it. It was pretty intense. But there are some serious adverse effects. And I didn't write them all here because you really should look at the information about each vaccine when you're about to get a vaccine. Ask for what we call a vaccine information statement. I'll show you a sample of that. And you can really look at specific things that you should be concerned about there. But allergic reaction is on all of them, right? If you've ever had a reaction to this vaccine before, you should not get it today, right? Allergic reaction means like swelling of the mouth, hives, trouble breathing, those kind of things. The rotavirus, this one is an oral vaccine that kids get to help prevent diarrhea. One of its serious adverse reactions is what we call intussusception. It's an issue with intestine, kind of like folding over on itself and causing almost not what we call allergies. So sometimes those self-resolve, but that's a big side effect. That's not a side effect. That's an adverse effect. That's not something we want people to happen with that. So again, that's still rare, but it is an adverse effect we've seen with that vaccine. It hasn't happened frequently enough for them to think that it needs to be removed from the market, though. So just like I mentioned with immunizations, other things we do for prevention also have adverse effects or risks, and it's important to know that too. So some screening tests have been under debate because maybe they detect disease that's not really clinically significant, like it's never going to kill the person. So finding it then just causes emotional stress and extra costs of testing and treatment that might not be necessary. So that's one of the downfalls with some screening tests. For behavioral counseling, I talk to my students about this. Well, if you go tell your patients that they need to go get a gym membership when they are living on $10 a day, it's not very effective, right? You need to think about what you're recommending and what you're talking to them about, because you might be causing more harm by making them take their recommendation. And then, of course, anytime with chemoprevention, when we're using medicines, there's always potential side effects from medications. So that's important to know about, too. Any questions about anything so far, the pitfalls or myths?
With flu shots, I've been a victim like your husband, so I've chosen not to do it. But just out of curiosity, during pregnancy, is it safe to do a shot if it has not treated you well in the past?
I don't think anyone, even with what you had before, they wouldn't say don't do it because of that, because they would just call that a side effect. If you just had the fever and stuff and you were better within a day or two, they would call it a side effect, not a serious adverse effect. It didn't have a long-lasting thing, so I don't think they would probably be worried about it during pregnancy either, to be honest. But there's like with influenza, one of the serious ones is called Guillain-Barré syndrome, where you get paralysis of your legs. Sometimes you recover from that, but if you've ever had that, they will say, don't get the flu vaccine again, or don't get whatever vaccine you've had that caused that, because there's a couple that can do that. Super rare, again, adverse effect, but serious enough that, don't get that one again. And so each package insert, as well as the VIS sheets, will say something like that. And they'll even say, don't get this vaccine in pregnancy. There are some that you shouldn't get during pregnancy. So definitely make sure that you talk with your doctor about any vaccines you're getting and your specific medical conditions so that you know if it's okay or not. Okay, so the process of testing vaccine safety. So the FDA does test everything on multiple levels. And actually, I think I'll just show you this little video for 5 minutes to give you a sense of how that process goes. And I'd like to hear your feedback about this video. Do you think it's an effective communication for the public?
The journey of your child's vaccine. A vaccine must be safe and effective. How a new vaccine is developed, approved, and manufactured. Vaccines begin the journey in the laboratory, where scientists work to figure out how best to protect against dangerous germs. Before a new vaccine is made available to the public, researchers usually must do years of lab tests on the vaccine. If lab results look promising and the vaccine appears to be both safe and effective, volunteers will be enrolled to get the vaccines in a series of carefully monitored clinical trials. The manufacturer usually conducts 3 phases of clinical trials. Each phase is designed to gather more information about the vaccine's safety and how well it works. These trials can take years to complete. During phase 1, about 20 to 100 healthy adults get the vaccine. Researchers track how well the vaccine works, whether it's safe, what is the correct dose for disease protection, and what possible serious side effects may occur. In phase 2, hundreds of volunteers participate. This is when experts learn more about the possible short-term side effects and how the volunteers' immune systems are responding. Phase 3 trials are the most informative, with results from hundreds or even thousands of volunteers. In these trials, vaccinated volunteers are compared with volunteers who receive another vaccine or no vaccine. These results give researchers a better idea of how well the vaccine works and if there are possible side effects they should expect. The Food and Drug Administration, or FDA, along with the Vaccines and Related Biological Products Advisory Committee, review all of the data the researchers have gathered throughout the trials and decide whether or not to license the vaccine. Once licensed, vaccines are made in batches called lots. Manufacturers test the lots to make sure the vaccines are safe, pure, and potent. The FDA reviews the safety and quality of each lot before it is released. The FDA inspects manufacturing facilities on a regular basis to ensure quality and safety. How a vaccine is added to the U.S. recommended immunization schedule. Once the FDA licenses a vaccine, CDC brings together the members of the Advisory Committee on Immunization Practices, or ACIP, to review all of the research available on the licensed vaccine. The members of the ACIP include world-renowned vaccine and disease experts from groups like the American Academy of Pediatrics and the American Academy of Family Physicians, CDC, and other government agencies. These experts look at how well the vaccine works and whether it's safe when given to different age groups. They also weigh the seriousness of the disease the vaccine prevents and figure out how many children would get sick if they did not get vaccinated. The experts then decide if they should recommend that vaccine be added to the U.S. recommended immunization schedule. If the CDC approves the experts' recommendations, the vaccine officially becomes part of the schedule, and soon it will be available at your healthcare provider's office. How a vaccine's safety continues to be monitored. Once children start getting the vaccine, the FDA and CDC continue to watch for possible side effects. Reactions that happen after a vaccination get reported to the Vaccine Adverse Events Reporting System, or VAERS. Anyone can submit a report to VAERS, including parents, caregivers, patients, doctors, and nurses. However, the reactions that are reported may or may not be caused by the vaccines. They may require further investigation. Researchers at FDA and CDC analyze the VAERS reports and look for any trends that may be happening. FDA and CDC also use other vaccine safety systems. The Vaccine Safety Data Link, or VSD, and the Post-Licensure Rapid Immunization Safety Monitoring System, or PRISM, actively monitor new vaccines to obtain additional information about their safety. VSD has access to healthcare information for over 24 million people. PRISM can analyze healthcare information from over 190 million people. CDC also uses the Clinical Immunization Safety Assessment Project, or CISA, to study vaccine safety. CISA is a collaboration between CDC and 7 medical research centers. CISA vaccine safety experts conduct individual case reviews and clinical research studies about vaccine safety. Recommendations for using the vaccine may change if the vaccine's risks are found to be greater than its benefits. The end goal is always the same: to safely and effectively protect children, families, and communities against potentially serious diseases. For more information, please visit cdc.gov/vaccines or cdc.gov/vaccine-safety or fda.gov/CBER.
So, was that informative for you? Do you think if physicians showed this to their patients in the office, do you think it would be level appropriate for most patients? Would it be informative? Right. Yeah, and I don't think immunizations probably would either.
It was government.
It was a little government boring. Yeah.
The drug acting about it. I didn't even know.
Right. Yeah, like the different groups even at the end. I was like, please don't ask me any questions about PRISM because I don't really know that much about it, right? I didn't even know about it before I talked about that. I knew about VAERS, the reporting system. And even on the bottom of every vaccine safety sheet, there's information about how to report.
It was higher level, but I didn't know if we could.
Right.
I mean, there were some things in there that were,
I think so too. Yeah, and knowing that even after it's approved, I think I knew every dot was tested, but I didn't know that these other data links were there continuing to monitor safety on vaccines. That one, so PRISM, it said 190 million patients. That's like 2/3 of this population almost. So that's pretty great to know that there's that much potential data that they're mining. Unless you're worried about privacy issues, which is in a whole nother conversation. So if you did have any questions about that, there are some infographics that I put in the slides here too, but they pretty much say the same thing. I thought I would just share the video instead, but it talks about the process that they shared with us. The next thing I wanted to talk about is just to let you know there are different types of vaccines. So while some people might have concerns about one type of vaccine, maybe then another type of vaccine is less concerning for some people. So in the beginning, we used to use a lot of live attenuated vaccines. We still have some of those, meaning that the organism's still alive, but we did something to make it weak so it doesn't make it sick. And then we use inactivated ones too, where the organism is there, but it's been killed, so it can't make you sick, but all its particles and pieces are there. And then we've done some where we've just taken out certain particles and pieces instead of having a whole thing. And I wonder if they did that a little bit to help reduce almost the intensity of that immune process development that sometimes makes it feel like we get sick from a vaccine, and so that it's not quite as intense, but they took the most important pieces that your body's still likely to want to develop an immune response. And the same thing goes for the toxoid. Like, this is what makes us sick, so that's what we want our body to develop an immune response to, is the toxin that comes from certain bacteria. So there's 4 really different types of vaccines. And if you do want more information about that, I'm not going to go into the details. There's a link here where you can read more about that, but that gives you a rough overview. One of the things that raises a lot of concerns for people with vaccination is the other ingredients that are in vaccines. And so here's an example of the different categories of the other ingredients and some example names of what those are. And I too said, I really kind of wonder, why are these in there? The good news is each one really does have a key important purpose, or it wouldn't be there. And most of the time it's to prevent from the bottle or vial getting contaminated and getting infected with some other organism that doesn't belong in there, right? So that's kind of the purpose of the antibiotics and the preservatives. So that's kind of the purpose of that. This one scares a lot of people, formaldehyde here. It's an inactivating ingredient. It basically kills the viruses or toxins when they make it, so that kills vaccines. What I read about that was actually your body has more formaldehyde naturally occurring in our body than exists in a dose of that vaccine. So that it's really minuscule. So that's really good to know. The eggs are used to produce influenza vaccine. They really do try everything they can to remove all of it that they can, but there can always be tiny amounts, so that's why they still label it. They do think that if someone had, and this is often again with influenza vaccine, that if you have an egg allergy, but you've had the flu shot before and you've never reacted to it, then you should be fine. If you've reacted to a flu shot and got hives, like the itchy hives, then probably what you can do is still have it again, but maybe take some Benadryl or something to prevent the hives before having it again. But if you ever had a more serious allergic reaction like anaphylaxis, swelling of the throat and all that, and trouble breathing, then you probably should not get that. So there's some of those kind of mitigating decision making that goes on with some of that. This is an example of a vaccine information sheet for one particular vaccine approved for adults over 55. It's the shingles vaccine. And this is what all the vaccine information sheets structurally look like. The first bit is, what is the disease and why is it important? What is the vaccine protecting you from? Why would you not want that disease, right? And then it tells you a little bit about the vaccine itself, what type of a vaccine is. We talked about these 4 types. And then talks about people who should not get this vaccine. So these are the contraindications. So like this one here, it says pregnant. If you had a life-threatening allergy to it before, and some vaccines, like for the rotavirus, it'll mention the infection issue. And then it also then talks about the risks of getting the vaccine, and these are the most common things out there, but then these are other more rare things that can happen that they list secondary. So for something I found interesting when I wrote this earlier. It talks about pain, redness, soreness, swelling of site of injection, headache, muscle, aches, fever, shivering, fatigue. I think that's listed probably on every single vaccine because those are typical sensations and feelings we have when we're developing our immune response to the vaccine. And then what to do if you have a serious problem, and then how can you learn more? So besides these vaccine information sheets, the package insert actually has a lot more information on it. And most vaccines are individually batched, so you can ask your physician for that or your care provider for that if you want. And then also has on here a website for the CDC. And here's the VAERS reporting system phone number. So the website and that. So if you have an adverse reaction, your doctor should be giving you these vaccine information sheets when you get a vaccine. Take it home with you so that way if you have questions, you can go back and refer to it. You could also report events as well. Okay, so this is the app that I was mentioning earlier that you can download. It's just called CDC Vaccines. It's pretty easy to find, but you can click on adult and put your age in there, and then select any specific medical concerns you have, and it'll kind of show you what the vaccine schedule looks like for you. And when you go to your care provider, this is the typical immunization sheet that we're looking at. And it kind of gives all the vaccines over here. The yellow is ones that are standardly recommended for all adults, and the purple are special situations. People with certain conditions might want to get this disease or this vaccine. And they're higher risk to that. And again, depending on the timing, if you've had stuff before, so there's way more text and detail that go with this. So you're always having to look at that and then go read the text every time. So because every patient's different, and so it really is a process, a complex process to decide which vaccines you should get. So just wanted to show you a sample, though, of what that looked like. This is the one for adults, and then this is the one for children. So you can see it's much more frequently in the timing, A lot of vaccines at 2, 4, and 6 months. Those are the most common there. So the future of vaccines. So they're are developing some vaccines that are DNA vaccines, which is kind of exciting for some hepatitis B, which we already have a vaccine for, but malaria. That would be exciting to see a vaccine for malaria. And then they're also looking at using vaccines not just for prevention, but for therapeutic, meaning treating a disease after somebody already has the disease. So that would be a different use for vaccines, be therapeutic. And also not just treating infections, but non-infectious things like cancer and allergies. So that would be exciting to see those things come down the pike. And then they're also looking at new methods for how we can get vaccines, because no one likes getting a shot, right? So maybe we would be better about getting our vaccines if we could like eat something or just rub something on us, right? So that's a couple of things that's also being investigated. So in summary, I think that the benefits outweigh the risks for vaccinations. Of course, everyone needs to make their own decision about that. So when you decide to get vaccines for you and your family, your patient preferences absolutely should be taken into account. But I encourage you also, though, because care providers often, especially for adults, forget to discuss vaccines. And so that's why I think we have such a low vaccination rate for that tetanus, diphtheria, pertussis. We think of it during flu season, but the rest of the year we don't really think about it. So take a little proactive approach, talk to your care provider about what your immunization needs might be and any questions that you might have to. Here's some resources if you need anything, and I'm happy to answer questions.
I do have a question about the HPV. I know that that's to women. We all get pap smears to do preventative care. But the throat cancer, for example, how do men do or women?
Men and women can get throat cancer from HPV. It's from oral sex, typically, I think. Yeah, you're welcome. It is typically a sexually transmitted infection. Women, we can find it via pap smears. There's no way to easily test them for it unless they have a lesion. And even then, we typically don't test for it. We know what kind of lesions it's causing. Warts, usually. Like all warts, common warts, those are HPV, but they're usually not cancer.
Now there are protocols.
Are there?
Yes. So I sit on the other side of the fence. So they have protocols for looking for massive lumps, any of these kind of things.
And someone may know has HPV?
Yeah.
Okay.
Yeah.
Interesting.
Yeah.
That'll be helpful.
Because this is one of the faster growing oral cancer.
Yeah. Right, exactly. That's been one of the
and the outcomes are very poor.
Yeah.
So why are they asking 8, 9 children to do that?
Because they want to get them before they're sexually active. Because the vaccine can't prevent something you already got. Yeah.
When is it too late to get the vaccine?
26 is the late age for women, but that's only because when they studied it, they didn't study it much later, so they know it's effective up to that age, but they don't really know how effective it is when you're older. And when you're older than that, too, your chances of likely already being exposed to HPV are generally pretty high because most people are kind of married and stuff by then, or been at least sexually active by that age.
So even if you've been sexually active and you are 25, you can still get the vaccine.
Yeah. It's not too late to get it. Even, I think, could you push to get it after 26? Yes. The risks would be it might just not work that well for you, and your insurance probably won't pay for it, so you might have to pay much for it. So, yeah.
Yes, so practically, as a family physician, when a patient comes with all these stories, how do you approach? How does one approach?
It's difficult. I think definitely a place of non-judgment, right? And just inquiring and trying to understand their beliefs and what their fears are first.
Right.
You don't want to dismiss their fears.
No. Or something with information. I mean, it doesn't convince anyone.
Share what you know, and that's where I was wondering, do you think this video would be effective? I think for those who are just concerned about, the risks of vaccines, maybe it might help some, but some probably have more of a moral or religious belief that probably was not going to address that for them. So yeah, I think we don't always have a lot of time to spend with our patients talking about vaccines, and so sometimes maybe having them watch a little video while we're documenting our notes might be an option, right? So, and then asking if they have questions after that. Huh?
Learning where their throat comes from.
Yeah.
If it's religious based, then there's no against them, but if it's, oh, well, my friend's daughter.
And that's often what it is. Like, oh, no, I heard this.
And
Okay,
that's,
fine.
I mean, I feel like Jenny McCarthy is like the big poster
Right.
child of autism, and why did so many people listen to somebody who has no medical treatment?
Right.
She grew up, and I feel like the poster child of that beach.
Yeah.
You know, everyone knows anybody can her.
Last week I watched a lecture actually about the non-medical exemption situation and anti-vax movement. And they really did talk about how social media plays a huge role in the growth of the anti-vax movement. And interestingly, what happens in our world right now on the internet is when you look at certain sources of information, that's what you get fed by Google. You don't really get stuff from outside your little information bubble. So all they're getting now is stuff from their own little information bubble that they've already created via their search histories. And so they don't really get the flip side much. So when they actually try to track like who's seeing this anti-vax stuff on the internet, and it seems to be just fairly isolated in circles among the same group of people who are most concerned. Yeah.
People think that's sexual unbalance. They don't realize
Right.
that what to reinforce the
Right. Well, and I do think some people, I think about my parents, right? They didn't go to college and, you know, they don't know how to think scientifically. They just were never trained how to do that. Yeah.
There's a similar movement for ultrasound.
Oh, really?
I sit in the bioethics committee there, you know.
Wow.
Yeah.
Interesting.
There are textbooks, there are books published.
They don't almost always do an ultrasound.
Well, again, these people say that's over.
It's not cause and effect because
Yeah.
everybody's different.
Yeah,
Some people.
no, they make a very coherent sounding story, very risky.
Well, thank you guys for coming today.